There's a couple of drugs that could be nearing approval, regulatory approval. One of them is venetoclax, which is an anti-apoptotic protein. It's a BCL2 inhibitor. And it is a drug that has shown some activity in relapsed refractory AML as a single agent. But where we've been most impressed is in newly diagnosed, untreated patients who are not fit for intensive chemotherapy. The combination of venetoclax with either low-dose Ara-C or hypomethylating agents has been very impressive, perhaps much more than anyone would have expected. So this is an exciting drug. It's probably one of the biggest new developments in the past year or so. And for this reason, there's a lot of interest, and I think it very well could become something available in the clinic in the near future. The other potential drug that I could see reaching the clinic might be quizartinib. Of course, we have midostaurin, which is a FLT3 inhibitor. It's a first-generation FLT3 inhibitor. It's a multi-kinase inhibitor. That is a drug that does not have much activity for relapsed refractory patients, but for newly diagnosed patients, it is approved in combination with standard chemotherapy. Quizartinib is a second-generation FLT3 inhibitor. It's much more potent against the FLT3 ITD mutated AML. And in the relapsed refractory setting, there's now data that's recently been presented showing that it is better to some degree than standard of care chemotherapy. So statistically speaking, it was an improvement in overall survival. Some would say the results are a little bit modest, but I think there's a fairly good chance based on those results that it will be approved.